Hello everybody, my name is Dr. William Davis and I'm a senior lecturer in the Behavioural Genetics group within the Schools of Psychology and Medicine at Cardiff University in the UK. For several years, my group's been interested in a condition called X-linked ichthyosis, and in particular the behavioural features and psychiatric symptoms associated with this condition. In this video, I'll summarise two of our recent papers on this topic. X-linked ichthyosis, or XLI, is a rare skin condition characterised by the presence of large dark brown scales, often on the neck, trunk, the front of the knee and the outside of the elbow. It is caused by deficiency for the enzyme steroid sulfatase, which is normally made by the STS gene located towards one end of the X chromosome. Genetic mutations which cause XLI can affect just the STS gene. There can be deletions encompassing STS and a couple of genes either side, and these are the most common types of mutation. Or they can be larger deletions encompassing multiple genes, and these larger deletions often tend to be associated with the greater number of physical problems. The X-linked location of the STS gene means that it is mainly males who are affected by XLI. Approximately 1 in 1,500 males are thought to have the genetic mutation associated with STS deficiency, but XLI only affects between 1 in 3 to 6,000 males, suggesting that there are many individuals who lack STS who aren't diagnosed for some reason, perhaps because their skin condition is relatively mild. In the skin, deficiency for STS causes a buildup of a chemical called cholesterol sulfate, which in turn leads to the characteristic scaling. But besides playing an important role in the skin, STS is also normally active in the brain. Potentially, its absence in this organ in individuals with XLI may have behavioural consequences. Before our studies, limited information from a handful of individuals with XLI suggested that this might indeed be the case, although these individuals' behaviour was not compared to a healthy comparison control group, so drawing definitive conclusions regarding the precise effects of STS loss was difficult. In 2016, we ran an online survey distributed worldwide with help from our partners, including charities such as the Ichthyosis Support Group in the UK and the Foundation for Ichthyosis and Related Skin Types in the USA, together with various social media sites. And this survey was designed to systematically compare the behavioural profile of a relatively large sample of men and boys with XLI to that of non-affected males. The findings of this survey have now been published and are freely available online within this paper. Briefly, we found that both boys and men with XLI were more likely than males from within the general population to exhibit high levels of traits related to attention deficit hyperactivity disorder, ADHD, and autism spectrum conditions. These traits included distractibility, planning and organisation problems, acting without due consideration, and anxiety in novel situations. Higher levels of these traits tended to be associated with larger genetic mutations, and autism-related traits were particularly high in individuals with the largest genetic deletions, encompassing a gene called neuroligin 4X, or NLGN4X. Boys with XLI were also more likely than boys from the general population to have been diagnosed with ADHD or autism spectrum conditions. Our other main finding was that men with XLI were more likely than men from the general population to exhibit mood-related symptoms, and to have been diagnosed with a mood disorder, notably depression. We couldn't tell whether this association was due to a direct lack of STS in the brain, or whether the increased rates of depression were linked to having a potentially stigmatizing skin condition. So these data add to the emerging evidence that males with XLI, on average, exhibit personality differences from males within the general population. It's important to emphasise that having XLI is not necessarily associated with having behavioural problems, but simply with moderately increased risk for developing such difficulties. Many individuals with XLI scored well within the usual range for most of the traits which we assessed. Additionally, exhibiting high levels of ADHD and autism-related traits is not necessarily a cause for concern. High levels of ADHD traits have been associated with positive characteristics, including creativity, enthusiasm, charisma, and sporting prowess, whilst high levels of autism-related traits have been associated with conscientiousness, reliability, and trustworthiness, and are commonly seen in many professionals, including scientists and mathematicians. However, we estimate, based upon our findings and that of previous studies, that approximately 30 to 40% of cases of XLI may be associated with adverse behaviour patterns which impact significantly upon everyday functioning, for example at school or work or socially, and which may warrant a mental health diagnosis. ADHD, autism spectrum conditions and mood disorders are all associated with lifelong challenges, and these can potentially be minimised with appropriate early interventions. In approximately 85% of cases, males with XLI will inherit their genetic mutation from a carrier mother. Females with a mutation affecting STS do not usually have ichthyosis, as the unaffected copy of STS on the second X chromosome can compensate. However, such individuals may present with milder symptoms such as dry skin. In female mammals, there's some evidence that levels of STS in the brain and blood increase during late pregnancy and into the postpartum period. So that's the 6-week or so period following childbirth. We also know that female carriers of genetic mutations associated with XLI are at increased risk of obstetric complications during childbirth, specifically delayed or prolonged labour as a consequence of insufficient cervical dilation. We've recently undertaken a second large worldwide online survey to compare the behavioural and psychiatric profile of female carriers of XLI-associated mutations to that of women within the general population, to see whether female carriers exhibited a similar pattern of behaviours to that seen in males with XLI. Given the known effects of STS and STS deficiency on pregnancy and childbirth, we were particularly interested in whether female carriers were more likely than women from the general population to have been diagnosed with a psychiatric disorder after giving birth. Again, the findings of this survey have now been published and are freely available online within this paper. We found that the behavioural and psychiatric profile in female carriers closely mirrors that seen in males with XLI, although the effects in female carriers were, as expected, slightly smaller. In terms of the postpartum period, we found that female carriers were approximately 1.5 times more likely than females from the general population to have experienced any psychiatric episode within 6 weeks of giving birth. This effect seemed to be most pronounced for mild postpartum depression, which was around 2 times more common in female carriers than in women from the general population. Our parallel work in mice has suggested that increased levels of the pro-depressant protein molecule CTGF, which is also known as CCN2, in the maternal brain may partially mediate this effect. If we confirm this, administration of drugs to reduce CTF levels may be therapeutically beneficial for female carriers with postpartum depression. So far as we could tell, there was no obvious relationship between having a stressful birth and subsequent postpartum psychiatric disorder risk in female carriers. So we hope that our findings will help to raise awareness of the possibility of mental health issues within families affected by XLI and their doctors to ensure that affected individuals get treated as early and as effectively as possible. We recommend that individuals with XLI, carriers of XLI-associated genetic mutations, or parents of children with XLI who are concerned about behavioural or mental health issues should contact their GP or medical professional with a view to being assessed by a specialist in mental health. Finally, we hope that our results will enable genetic counsellors to provide useful and up-to-date information to individuals newly diagnosed with XLI, to carriers of XLI-associated mutations, or to parents of children with XLI, which will be important for their future decision-making. Over the next few years, we aim to understand the cognitive processes and brain pathways that are affected by STS deficiency through parallel studies in humans and animal models. I'd just like to conclude by thanking all of the participants in our studies so far. And if anyone would like further information on the studies which I've described here, or if you're interested in taking part in our future studies, please feel free to contact us using the details presented here. Thank you for listening.